Hi, welcome to TLC. My name is Wendy Bombard and I'm a registered nurse who works at TLC as the TLC educator. And today I'm going to be going over policies and procedures which will formulate the orientation that you will need in order to work here. So we're going to get started. On the first slide you will see three different offices that TLC has. One is our hub office, which is the center of all the action. That is going to be in South Burlington, Vermont. And you will notice that we have office hours 8 to 5. We also have another office in Barre in Vermont, and you will see that's by appointment only. And the third office is in West Lebanon, New Hampshire, and that is also by appointment only. TLC was born in 2006 by an ambitious registered nurse named Mohammed. Mohammed was a nurse who was working with some clients in facilities, and he very much wanted to provide a way for them to be able to be home and to be cared for appropriately. So he built this company with the idea that he would offer a home care option as well as staff facilities across Vermont and New Hampshire that needed extra assistance in caring for the elderly. In front of you is a lady by the name of Sally Dondis. Sally Dondis was TLC's first client. She has since passed away, unfortunately. However, we did care for her till the very end. And Sally was a very big part of how TLC came to be, and we're going to listen to why.
What about our caregivers? How do you like our caregivers?
The caregivers are all very nice, kind, and very good. And above all, Avi is the scheduler. He's everybody's friend. I treat all the caregivers like my daughters, and I show them what to do. And they always do. He has been helpful in every way. When I came back from the nursing home, Muhammad at TLC had a bed ready for me, and it was like a hospital bed. And he started a routine with a bed and with everything else, and we're still doing the same routine to this day. I believe it's been 5 years since Muhammad's been supervising and helping me. If you need, maybe I said, if you need tender, loving care, call Muhammad at TLC. Muhammad and I created a foundation for TLC. We are the co-founders. Thank you very much.
So that is how TLC was born. Our next slide is going to show you all the different people that are here in the office and across TLC that will be your support system.
Hi, my name is Mohammed Basha. I'm the founder and CEO of TLC Home Care and TLC Nursing Associates. I started the company because I'm passionate about caregiving and I'm passionate about helping facilities in New England to cover any of their needs that they have. One of the things I want you to take away from today's orientation is that know that there's always people behind you to support you and assist you in any way possible. I'm always available. My door is always open to all of our staff. So if you have any questions or concerns that is not answered, you can always contact me. And enjoy the rest of the orientation and welcome aboard.
Hi, I'm Mallory. I work in human resources here at TLC. I'm the HR coordinator. And if you're watching this, then likely we've already spoke before. I work in the hiring process. And I love working here because there's such a sense of community, and I love all that we do to give back to our elders.
Hi, I'm Ann Blackburn. I'm one of the nurse case managers here at TLC. Welcome on board. I actually cover the territory in southern Vermont, from Middlebury, Vermont on down, and all of the clients in New Hampshire. And I have to tell you, I really feel that we fill such a big need in the community for people who need help in their homes. It's a wonderful place to work.
Hi, my name is Nancy. I'm a nurse case manager here at TLC Home Care. I work in central and northern Vermont. Basically, what we do, I assign my clients onto services. I manage the clients as well as field staff to ensure that everybody has the best care that they can have. I'd like to welcome you on board to TLC. Thank you.
Hey guys, I'm Avi Ambecker. I'm the business manager for TLC. I've been with TLC for 12 years, and as you know, here we help our seniors in Vermont and the larger New England region, and also help hospitals and facilities with their nurse staffing needs. We are looking forward to work with you, and can't wait to have you come join our team here. Thank you so much.
Hi, I'm Kat. I work at the front office here at TLC. I help with coordination, making things happen. I'm kind of here, there, and everywhere, helping everybody out. I work here because it's a company I can really proudly stand behind, and I enjoy being kind of an active role in people's lives.
Hi, my name is Sharon Clow. I work at TLC. I do the payroll and the invoicing. I love working at TLC because who I work with and for. I feel we have a great need in the community. I have older parents, and I can see that TLC is exactly what we need.
Hi, my name is Shifa, and I'm here at TLC doing scheduling for home care. I'm doing this because I love caring for people and helping them and having things organized. And happy to have you all. Welcome aboard.
Hi, I'm Lauren Morelli. I am the operations supervisor. I am in charge of staffing, scheduling, and intake. I love working for TLC because the office staff is very welcoming. We enjoy seeing the different people coming in and helping taking care of our seniors in their homes.
Hi, I'm Caitlin Laudette. I'm the operations manager here at TLC. I oversee the nursing, scheduling, and HR department. What I love about working here is that we're a big family. We all work together, and we support our caregivers, our clients, and each other.
Hi everybody, I'm Sam. I am the intake coordinator, and I also have a hand in scheduling. The community here at TLC is really amazing, and we're happy to have you a part of it.
Okay, so that's our office staff. And now we're going to move on to learn about our virtual staff.
Hi all, I welcome you all on board. My name is Ana Theres Basanyas Dura, and I work as as a virtual assistant and on-call coordinator, I'm responsible for scheduling, customer service, and updates for social media for TLC. And I love working in TLC as they always treat me like a family and with respect. And I love the team collaboration. Thank you.
Hi, my name is Teresa Rochelle, and I'm a travel experience coordinator with TLC Nursing. I help nurses and nursing assistants from around the country to find travel assignments that suit their interests. I am happy to be a part of Team TLC because even though I work 800 miles away, I know that the rest of the team is always there for me.
Hi, my name is Charles Blankenship. I'm a senior travel recruiter with TLC Nursing. I look for and recruit travel nurses and nursing assistants and have them come up to the Northeast on short and long-term assignments to assist with our facility clients' staffing needs. I like working for TLC because here they make you feel like you're a part of the team rather than just another cog in the machine.
Hi everyone, I am Jingki. I work for TLC as a payroll and billing assistant, and what I love about working with TLC is a sense of camaraderie among employees, and you know to yourself that you're a part of this bigger community that lives to serve other people. Thank you and welcome.
Hi, my name is Seal. I'm a virtual recruiter and I work with the HR department and help them with screening the applicants. I love working with TLC because everyone is very supportive and we have a very great teamwork. Welcome on board.
And this is a very small snippet of our awards that we are continuing to get. You will notice in 2020 that we did get Best of Home Care Award, and that is a SeniorAdvisor.com award that's rated by families. We're very proud of that. We're also very proud of our Best of Best Business Awards as well. As I said before, Mohammed had this vision of building TLC, and he had two different ideas. One was that he would certainly furnish a home care mission, but he also would have a mission for staffing to happen across Vermont and New Hampshire to help out our elderly population. And so we have constructed a mission statement and a vision for each of these different pieces of TLC. Because you are going to be working in facilities, you would be certainly looking at our TLC Nursing's mission, which is to bring great people together by providing qualified healthcare professionals to support your unique organizational staffing needs. And our vision is for our staffing that TLC Nursing's team is dedicated to providing our clients with the right people through our extensive screening process to meet your unique staffing needs. We do provide passionate and committed staff while creating a culture of caring and professional development. Moving into 3 words that Mohammed would like you to know: professionalism, preparation, and framework. Professionalism, if you can think about putting yourself in the position of a client, the way that I look at the word professionalism is, how would I like to be treated if I was a client? So starting at the very beginning, when you have a brand new worker coming to help you, some of the things that you would want to make sure of with that worker is how they were to address you. So when working with our clients, we're going to be looking at our attitude, our mood. We want to be using eye contact. We want to be having a smile, all things that would show sincerity as well as positivity. Also, a very big part of professionalism is enthusiasm. And so if you are excited to be at work, please show that because it does show our clients how much we want to be there for them. Also, professionalism includes knowing your job, knowing how to maneuver the equipment that you're working with, as well as what you're going to be doing with the client. And obviously the care plan is going to be a big piece of that. Some different morals or qualities that we should have when we are working with our clients are certainly honesty, as well as respect, and of course compassion. When we go on to the next word, preparation, essentially what this means is how are we going to be preparing for our position and our job? We want to be reducing avoidable risk. We want to be making sure that we are wearing the proper attire when we're working. We want to make sure that we are mobile. If we do need to get out of a situation quickly, we want to be making sure that we are wearing the proper uniform as well as the proper footwear. We want to make sure that we are presentable and that we look professional and that we are always wearing our ID badge. We also want to make sure we have a positive mood. We want to be creative. We also want to be certainly cautious, and we want to be observing both our clients as well as the environment around us at all times. We want to be prepared with our self-control. We want to know our own self and our own emotions so that we can be aware if we need to take a break to regroup. And for preparation, we also want to make sure that we're leaving all of our baggage at the door and that we're 100% focused on our clients. The third word, framework, essentially means how are we going to best support our company? In other words, what are some things that absolutely are necessary for our company to thrive? And if you can think about how a house has a frame, and that frame is usually steel, it's holding that house up. If you think about the word framework, it's really about what we need in order to continue to succeed. So you can see there timeliness, reliability, and punctuality are all very important for us to continue to succeed. We need to be on time when we're working for TLC, as that certainly is another part of professionalism. Communication, we need to be communicating with our supervisors as well as our caregivers. We need to be working as a team, that we are all in this together and we are all trying to meet the needs of our clients. We also need to be comfortable where we're working, so certainly the environment's very important. Patience, we need to be patient with one another as well as patient with our clients. Expect the unexpected, this is something that we really do need to be able to roll with it when things are different than what we expect. And that does happen from time to time, and we definitely need to be able to be flexible. We need to be documenting. Documentation is legal, and it is very important that it is done in a timely manner. And lastly, in framework, we need to be reviewing and improving. We want to be the best home care and staffing agency in all of New England. And in order to do that, we are constantly looking to see how we can review and improve and be better. Our home care software program is called Generations, and this is going to be a particular program that you can find on any device that has the internet. You can certainly find it on your phone. However, I do recommend that when looking at Generations that you have a laptop or an iPad, as we have a lot of information in different parts of the program that would be easily seen if you have a bigger device. Generations is how you're going to be able to view your schedule and your care plan. If you look at Generations, you will find that when logging on, you will need to have 3 different pieces of information. You will need to have the agency ID, which is TLC N6564. You will have your own email address and your own password. The only way that you can access Generations is having those 3 pieces of information plugged in. So those pieces of information will be sent to you as soon as you become TLC employees. We are about to start a video on how Generations works, and this video was done by one of our older operation managers. Her name is Courtney, and she's going to go through how Generations works for you.
Hi everyone, welcome aboard TLC. My name is Courtney O'Brien, Manager of Operations. Today I want to go over our Generations scheduling software system with you all. This is where you're going to be able to find your schedule and your client's care plan and all your other information that's important prior to going out to your client's shifts. So to get to that software system, what you want to do is pull up a Google browser and type in our website, which is www.tlchomecare.com or tlcnursing.com. When you get to our main website, in order to find our scheduling software, you're going to click on Employee Resource tab, and then How to Use Generations. You'll notice down here on the right-hand corner, there's a Chat Live Now box. This is a system that you're able to chat with an outside source that can provide you with answers to certain questions. However, the person on the back side of this chat is not a TLC office associate. So if you're looking for a prompt answer about your schedule or your current client, the best thing to do is give us a call on our main line, which is 802-735-1123. To log into Generations, you're going to click here on the Access Generations link. And each and every one of you will have your own login information. However, today we're going to be utilizing a training login. You'll notice here that it does require that there's an agency ID. Our agency ID is TLCN 6564. That agency ID is going to be the same ID there we go. That agency ID is going to be the same ID that we utilize for all of our employees. Most of the time, the system is going to auto-populate that information after you've already logged in. However, if it doesn't, you can go back to this screen here, and it has that information right here. Okay. We're going to log in using the training login. Once you log in, it's going to bring you to your schedule. You'll notice that the pink here is the day that we are currently on, and this is your current schedule for that day. Here next to the month, you can go back and look at your previous schedule, or press the forward arrows and look into the future and see what you're scheduled in the future months. Your main information is going to be here on the top right-hand corner. And here's your schedule. So it's very important before going to your client's home that you log on to the software system and view the client's care plan. This is going to show you all of the information that you need to know prior to going in the home. In order to do that, just click on TLC Training here, which is the client that we're going to be visiting today. And it's going to auto-populate your care plan. A little longer. And so here in your care plan, you're going to see that there is the client's name and information here, the date of the start of care. You're going to have your address and your case manager. Ooh. Keep drawing over the information. Your address and your case manager's name there. And then it's going to provide you with all of the information that you'll need here. So it's going to go over your functional limitations, activities permitted, their mental status, their prognosis, and it brings you down into their care plan. So this is where they're going to talk about their mobility, their bowel and urinary, if they need assistance with bathing, dressing, shaving, any skin care that they need assistance with, hair care, oral care, and nail care. Keep in mind that we are not able to clip fingernails or toenails. We can only make sure that they are clean underneath. It's going to talk about whether they have vision impairment, hearing impairment, any concerns with their nasal or respiratory system,